So I wanted to touch bases on these issues that we've had over the last couple of years with Zoll and our Zoll defibrillator. So these are the current pads that we've had for about 7 years in the hospital. This is just a simple, quick connect. And these are ones that you should, we still carry in the department. You should only be using these for your conscious patients that we're going to potentially do cardioversions. The stable patients, if the doc asks you to throw pads on them. The other pads that we most recently switched over to is the one-step CPR, and it's multi-functional electrodes with pacing. So this is the key word. And we should only be carrying these we carry them in the ER and down in distro. Unfortunately, all of these other ones is what the field is using. So this one here is used by Salt Lake City Fire. It looks like a normal, your normal pad. It has a puck. The telltale sign is this piece here. City Fire will still be bringing the patients in on this particular set of pads. We have had this in the trauma bay for the last couple of years. Basically, this just slides on, and then this would connect to our Zoll. We've had a lot of issues with using this lately. It's been giving us failures, and it won't let us shock the patient. So we've moved away from this. We moved away to switching the patient out as soon as they get here to our pads as quickly and as efficiently as possible. But make sure you're grabbing the one-step CPR pads, and then it has this connection. Another downside is this pad that looks identical. These two, they're both called one-step CPR pads. They both have the same connector. Unfortunately, they do not do the same. They do not have the same capability. So this one, if Unified Fire brings the patient in, you will not be able to pace your patient if you guys get the patient back. So they connect the same. This is where the confusion comes in. And all of a sudden you think that you're going to be able to pace your patient, but these do not have pacing capabilities. So if you notice our pads compared to their pads, this is your telltale sign. It has the little 3 leads built in. So these are university pads, and these are your EMS pads. So just get in the hang of switching out the pads to the university pads every single time you get a cardiac arrest or a patient that is going to potentially code. These are not patient chargeable. The hospital eats the cost, and Emily and the education team is on board with switching out these. Another thing is, we're going to touch bases really quick, is this is designed to be movable. So it has a little cut in it right there. So if you're doing CPR, basically you can rip this off. You can slap your pads on front to back, and you can still put this over the patient's chest and then utilize it with the Lucas, so it'll give us the CPR feedback. Any other questions or concerns? Feel free to get a hold of the education office, and they will fill you in on all the other changes. Thanks so much.